Okay, so this is my causative agent project. My causative agent is tetanus. It is an acute infectious bacterial disease characterized by tonic spasm of voluntary muscles, especially of the jaw, caused by an exotoxin of Clostridium tetani, which is usually introduced through a wound. The taxonomy of tetanus is the domain is bacteria, kingdom, EU bacteria, phylum, Firmicutes, class, Clostridium, order, Clostridiales, family, Clostridiaceae, genus, Clostridium, species, Clostridium tetani. My bacterial disease or causative agent is known as Clostridium tetani. It is a gram-positive bacillus bacterium. It is non-pleomorphic, so that means it does not change its size or shape, and it does not form cell aggregations. It does possess a flagella, but they do lose their flagella after they develop a spore. It produces on the surface a paracrystalline array that completely surrounds the cell. It is made up of multiple sites of peptidoglycan because since it is a gram-positive bacterium, that means it has a large peptidoglycan exterior. It produces endospores once it enters the wound site. There is a vaccine for it. My infectious disease is tetanus. The pathogenesis of tetanus is exogenous because it enters the body through deep open wounds that have either been contaminated by fecal matter or contaminated soil, or is simply as stepping on a rusty nail. It is an acute infection, but it can progress to be worse unless it is not treated. The bacteria has two toxins that can enter the nervous system via your lower motor neurons and travel up the spinal cord and brain stem. It can progress in the Clostridium tetani can progress in anaerobic conditions. They generate toxins known as tetanolysin and tetanospasmin. It is a non-communicable disease, so you can come in close proximity with somebody who has tetanus and not get it. The main toxin, tetanospasm, is responsible for causing the symptoms of the disease because due to it being very potent, that enters into the nervous system. Tetanospasm is also responsible for the muscle rigidity and the spasms that characterize the disease. And along with the muscular rigidity, there's also something known as lockjaw, which is another common name known for tetanus. It has an incubation period for 6 to 10 days before symptoms appear. And common symptoms or signs and symptoms are lockjaw, involuntary muscle tightening, headache, seizures, fever, and sweating. Since there is a vaccine, even though there is a vaccine, tetanus is preventable as long as you can keep the wounds open, the wounds closed and clean, and take good care of them. And the next slide, I have a representation of how the toxin affects the neuromuscular system. So in this picture, it gives you the example of the Clostridium tetani and the main toxin that is super potent, tetanospasm, and how it affects the neuromuscular system by inhibiting by the inhibitory transmitter. It blocks it, so that way your muscles are constantly tightening and just getting super excited, and it is not willing to progress all the way through the neuromuscular system. Prevention. There are 4 kinds of vaccines for tetanus. There is Tdap, DT, TD, and DTAP. The most common ones that we hear are the DTAP for younger children or the Tdap for adults. Babies and children younger than 7 often receive the DTAP or DT, whereas, like I said, the adults receive either Tdap or TD. It is a live type of vaccine that contains minimal amount of flocculation of each agent. It is a combination vaccine as well. It is administered by multiple doses. Most medical professionals recommend 3 or more doses as recommended. Obviously, if you do develop tetanus, it is recommended to get another vaccine just to keep it updated. However, most of the vaccines are taken at birth during the time of growing up through the childhood or during the lifespan development. Some preventative measures would be keeping wounds cut and clean and covered. This is the best way to prevent from developing tetanus. How to diagnose? There is not a specific test to diagnose tetanus. So most of the diagnostic procedures are looking for signs and symptoms, and the signs usually start with the jaw and progress down to the body. It includes painful and stiff muscle spasms, tension of muscles around the lips, difficulty swallowing, and rigid abdominal muscles. To determine if you have tetanus, the signs and symptoms are the deciding factor. This means, like I said earlier, that there is no hospital lab test to confirm tetanus. Most of the doctors can do a physical exam to diagnose because the signs are visible to the naked eye. And also, if it is these signs and symptoms will develop and progressively get worse over time. Treatment. There is no cure for tetanus. However, there is medical treatment that patients can do. Most patients should receive the intramuscular injection of human tetanus immune globulin, also known as TIG. And patients can also be given sedatives to help with the muscle spasms to make them more comfortable. And another treatment people can receive is penicillin to fight the bacteria with the penicillin fighting the bacteria and the sedatives helping control the signs and symptoms. Most patients are able to get over it. Tetanus does utilize passive treatments. Most patients will receive muscle laxers or painkillers to help subside the symptoms while trying to clear out the bacteria. And thank you. That is my project.